Hello, my name is Isabel Diaz, and I'm going to do some evaluation criteria for a series of shoulder X-ray. For a good X-ray, we always should see collimation around the area of X-rays. In this case, my first image is AP shoulder with the external rotation. And with external rotation, I go with my central ray just 1 inch below coracoid process, just be right here. And but this one I have greater tubercle profile. That's the coracoid process. Is clavicle. I have my glenoid fossa. For the internal IP internal rotation, the lesser tubercle is in profile. It comes right in here. It's a little bit more superimposed of the glenoid fossa, coracoid process, clavicle, and it's should be some collimation around subtissue, a little bit of subtissue, but the main thing is the shoulder joint and coracoid process around here. A little bit of the scapula, the body just a little bit, and like I said, obvious collimation around it. The next image is gonna be this is the superior inferior axial shoulder joint, and this one the coracoid process comes a little bit above clavicle right here. This is the humeral head and then the humeral body. So with this one, central ray goes between 5 and 15 degrees towards the elbow. It depending how the patient can open it. If it can open it, we'll go to 15 or less. In this case, I did 10 degrees towards the elbow. And again, we should see some collimation around some tissue, and just mainly just the shoulder joint. That's what we need to see. Our next X-ray view is for is AP oblique shoulder. In this case, you can do it's a left or right anterior oblique. In this case, I did right anterior oblique. With this, I need to see usually is done for trauma. And we don't have to abduct the arm or anything like that, but we just should through the scapula, the middle border, we go the central ray perpendicular to the scapular body, the medial border. A scapula should be perpendicular to the IR. This is a humeral head, and it's a coracoid, acromion and coracoid process, and scapular body right here. And again, there will be some collimation around it. Always gonna be a marker, the correct body part. Okay, with this conclude my evaluation criteria for a series of a shoulder. Thank you.